which of the following is the most consistent with this neonate's most likely condition? So this is basically what has happened is there has been an RH alloimmunized mother, because this patient was not given any prenatal care for the previous pregnancy. We do not know. It is a possibility that she has a negative blood group and her first baby had a positive. So she was RH alloimmunized. And when the second baby was conceived, it led to hemolysis, because see, whenever we talk about autoimmune hemolysis, no, the Coombs test will be positive. Okay, so if it is because some antibody antigen are involved in hemolyzing your red blood cells, then the Coombs test are positive. Okay, so this is a typical case of that. And so we know the answer. The mother generated IgG antibodies against the fetal red blood cells. Now, when to know it is IgM, when to know it is IgG? IgM are short term, they are acute. Okay. And then IgG are long terms. What you need to remember is the antibodies against your A, B, and O blood groups. Your anti-A, anti-B anti-B antibodies are IgM in nature. IgM is a pentamer molecule. If you remember your biochemistry, it is a very big, it is a M mega molecule. So it cannot cross the placenta. That is why ABO incompatibility in a mother and a baby rarely causes any kind of hemolysis. It can, okay, under certain circumstances. While your RH, anti-D, that is what we're talking about, anti-RH or anti-D antibody is IgG. And IgG is a smaller molecule, it is a monomolecule, so it crosses a placenta, and that is why this hemolytic reaction occurs. Okay, so whenever we're talking about RH alloimmunization, it is a IgG antibodies.
Thanks for watching. Please give a thumbs up and subscribe for more.